Since you are watching this video, we can assume you know what acid reflux is. But for those who do not, acid reflux is a condition where the gastric acid in your stomach comes up into the food pipe. It can cause painful sensations, nausea, inflammation, and difficulty swallowing. Acid reflux is a symptom of gastroesophageal reflux disease, or GERD. Gastroesophageal reflux disease is a condition where stomach acid flows backward into the esophagus, the tube connecting the mouth and the stomach. In simpler terms, it's when stomach acid backs up into the throat or chest. This condition is not related to age and can become very uncomfortable. However, you do not have to wait to experience acid reflux before you take preventative measures. So, we made this video to tell you the top 5 vitamins to stop acid reflux permanently. Number 1. Vitamin B12. First on the list is vitamin B12. Vitamin B12 can help stop GERD, a more severe form of acid reflux. Studies have shown that taking vitamin B12 as a supplement to your diet can lead to a high reduction in GERD. It can also help with esophagus cancer and bring relief from acid reflux. You can get your daily dose of vitamin B12 from foods such as dairy-based products, red meat, fish, and poultry. Because this vitamin is more prevalent in animal-based foods, there is a high tendency that vegans may have a vitamin B12 deficiency. However, you can choose to take supplements and vitamin B12 tablets to supplement the deficiency. Vitamin B12 is not only helpful to stop or prevent acid reflux, it also has numerous other benefits for the body. It is a form of antioxidant your body needs for its well-being. If you choose to take your vitamin B12 intake in the form of pills, it is best to get a doctor's prescription for dosage. Number 2. Folic acid. Folic acid is also known as vitamin B9. It is very essential and supports digestive health. A folic acid deficiency has been associated with many gastrointestinal symptoms, including acid reflux. An adequate intake of folic acid will help maintain your digestive tract and prevent acid reflux. You can get folic acid as supplements at pharmacies, or you can choose to consume food that contains it more. These foods include fresh vegetables, citrus, avocados, lentils, and broccoli. Some animal-based foods also contain folic acid, like the liver. A well-balanced diet should give you enough folic acid for the day, which is why you should always eat fruits. It is important that you know that acid reflux is not a straightforward condition. Folic acid alone may not be sufficient to permanently stop it because numerous factors can affect it. It is best to consult a healthcare professional for a complete treatment plan. 3. Magnesium. Another essential vitamin for stopping acid reflux is magnesium. Magnesium works as a muscle relaxant. It can relax the esophageal sphincter, or LES, and reduce the chances of acid reflux. The LES is a ring of muscles that separates the esophagus from the stomach. Normally, the lower esophageal sphincter keeps the acid in the stomach. However, the LES may not work properly in people with GERD, allowing the acid to escape. The most common symptom of GERD is heartburn, which is a burning sensation in the chest. Other symptoms may include regurgitation, a sour or bitter taste in the mouth, difficulty swallowing, a feeling of a lump in the throat, or a persistent cough. When it becomes weak and lax, it can allow acids from the stomach to flow into the food pipe. Magnesium's muscle-relaxing ability helps maintain the proper functioning of the lead and reduces acid reflux. It also has an acid-neutralizing effect. It increases the pH level in the stomach to reduce acid reflux symptoms. Not only does magnesium reduce the effects of acid reflux, but it also has some enzymatic reactions to promote healthy digestion. With an adequate magnesium level, you can maintain a healthy digestive tract and reduce the incidence of acid reflux. Although magnesium is very beneficial to your overall health, it is best to consult a healthcare professional who will check your health bill and determine if this supplement is appropriate for your consumption. Number 4. Vitamin A. Vitamin A is an essential nutrient that plays an important role in cell growth. It supports the integrity of the mucous membranes lining the digestive tract. Remember that your digestive tract is responsible for acid reflux. vitamin A contributes to stomach, intestine, and esophagus cell growth. It can contribute to the maintenance of a healthy digestive tract and reduce inflammation in the gastrointestinal tract. A week less, certain lifestyle choices such as overeating or consuming spicy and fatty foods, being overweight, or pregnancy are just a few of the causes of acid reflux. It can also be related to certain medical conditions or medications. That is why you should have these vitamins to reduce the effects of this lifestyle. Despite the positive effects of vitamin A, you should also know that taking it in high doses is bad for you. A high dose of vitamin A can cause irritation in your digestive tract. This irritation can cause nausea and vomiting. Ensure you consult your healthcare consultant to get the amount of vitamin A you need. You can get your daily amount of vitamin A from most foods, especially fruits. There are also over-the-counter supplements that can provide you with vitamin A. Ensure that you are not abusing this vitamin. While it can have great benefits, it also has side effects when abused. Number 5. Vitamin E. Vitamin E is a vitamin with anti-inflammatory properties. It can help reduce inflammation in the gastrointestinal tract and esophagus. When there is inflammation in the stomach, it can cause a rise in stomach acid, leading to acid reflux. Vitamin E can reduce inflammation and thereby reduce the risk of acid reflux. It also has tissue repair capabilities. It supports the repair of the stomach and esophagus tissues. Vitamin A also increases the integrity of the mucous membrane in the digestive system. More importantly, it is essential for proper immune function. It helps defend against gut bacteria that may have a negative impact on your digestive health and cause acid reflux. The long-term effects of untreated acid reflux can be problematic. The constant exposure of the esophagus to stomach acid can lead to irritation, inflammation, and damage, potentially causing complications like esophagitis, ulcers, or narrowing of the esophagus. You can get vitamin E by consuming nuts and seeds like almonds, hazelnuts, and peanuts. Vegetable oil, leafy green vegetables, and avocado are also good sources of vitamin E. Just like every other supplement, excessive intake can have adverse effects that will not help your acid reflux problem. It is best to take it in moderation or consult your healthcare professional first. Treatment for acid reflux typically involves lifestyle modifications such as avoiding trigger foods, losing weight if necessary, increasing essential vitamin intake, and eating smaller meals. Over-the-counter antacids or medications that reduce stomach acid production may also be recommended. In severe cases, prescription medication or surgical procedures might be considered. It's important to consult with a healthcare professional if you suspect you have GERD or experience persistent symptoms, as they can provide a proper diagnosis and recommend the most appropriate treatment options for your specific situation.